Welcome back to The Next Bit Bite-Sized. I'm Hannah McQueen, founder of Brightly.
And I'm Mark Leishman. Now, in this short episode, geriatrician Dr Cheryl Johnson tells us what the first symptoms of dementia look like.
So Cheryl, is that fatigue or could it be the first signs of dementia?
So when we think about dementia, we have to think about what we call functional impairment. And I'll talk about that in a second. So I think we all have times when our brain isn't quite working perfectly. You know, we've all gone into a room and gone, what have I gone in here for? I'll put my hand up and say, I've left an element on before and come back later and gone, oh, silly, and turned it off. We do forget things. Some of that is just, you know, we're tired, we're stressed, or actually just sometimes our brain just isn't working perfectly at that moment. That can be normal. As we age, our brains do change as well. Our cognitive processing speed reduces and our working memory reduces. Just as a segue, working memory is the memory that you need to use on whatever task you're doing. So at the moment, my working memory is kind of thinking about what do I need to know about dementia and what do I need to explain to everybody. What makes the difference between someone who's just forgetful or you know, actually probably normal and someone who has dementia is functional impairment. What that means is that their forgetfulness is impacting on their day-to-day life and how that person functions. So they're forgetting, you know, how to turn on the TV. You know, they're forgetting how to use their microwave. They're forgetting how to use their washing machine or forgetting how to take their medications or taking them incorrectly. So, you know, you can forget your medications one day. Doesn't matter, you know, you were busy that day, not a problem. But if you're consistently forgetting to take them and getting confused about your medications, there's the difference.
If it is dementia, what are some of the signs that their family and their friends could sort of look out for that might be an indication that things are changing?
It's quite varied. So I've yet to see two people with dementia that are the same, because obviously there's impacts on a whole lot of other things. And there's also depends on the type of dementia that person has. But sort of general advice, I think, would be around concerns relating to perhaps how they're looking after themselves. So people who, you know, were once really well turned out, maybe things are just starting to slip a little bit. You know, you might see that medication's a little bit jumbled or muddled, or, you know, not being able to sort of keep track of appointments and, just things in a bit of a disarray. One thing is lots of post-it notes around seems to be one of the sort of features, you know, so the person's starting to write things down because they're just not remembering them. So you're seeing post-it notes kind of around the place. Forgetting the sort of family events, like, you know, maybe you're all planning to go out for dinner on the weekend, and that person's sort of saying, when are we going out? Where are we going again? And, you know, that sort of repetitive nature of things. Maybe hearing the same story or the same anecdote or the same thing several times because the person's forgotten that they've already told you.
That's quite a common one, I would think.
It is.
Yeah.
Coincides when people are drunk as well. So it's less maybe about overt things that like, oh, you've got that, therefore you're on the way. It's more about patterns that you're noticing over time, little things, which actually you might just brush over, and it might not be. People say that if that people are diagnosed, oh, those symptoms were there, I just didn't know what to look for.
And sometimes it's a much bigger change that you go, oh, wow, things are really, really changing here. But looking back retrospectively, you can see all those little things adding up.
And you probably don't want them to have dementia as well, even if you were kind of sensitive. So you yourself don't step in to help slow it down.
You're hoping it's
Yeah, you just want to bury your head, basically.
Oh, absolutely. You know, dementia is a really awful diagnosis to have. It's a really awful diagnosis to make. But if I can offer a bit of hope, I think it is really important if the individual or if their family is worried about their memory to get an assessment. You know, with Brightly, we can assess the memory. We've got a module specifically around cognitive health. Do that assessment. Work out exactly what's going on. You know, work out, is it actually you're cognitively okay? We're cognitively normal. Maybe you've got mild cognitive disorder. Maybe you've got dementia. Work out where you sit, and then we tailor an intervention or a plan for that person to help them, you know, hopefully improve their memory or change what's happening and change their trajectory, and as well sort of wrapping around that support for the person and for their family.
So the little things that we forget, I think you mentioned this earlier, you know, you lose the car keys, or I don't know, you forget glasses. And on your face all the time. You know, they are not dementia. They're normal for all people of all ages, I suppose.
Yeah.
So that's not something to be too concerned about. But when it gets a bit more serious is when they are basically just, you know, starting to forget things, tell the same story twice. That's
Put the pot in the fridge.
It's the company it keeps. We always talk about that in geriatrics. So it's you know, as we said, you can forget things, and I mean, my son used to always forget things. It was terrible, and he, you know, when he was little, and that's normal, and it's normal for anybody to forget things. But it is really about what else is happening. Is it just as simple as I'm just forgetting, you know, I'm just putting my wallet down and I'm forgetting where it is? It's different to, you know, I've actually lost my wallet, or I actually can't find my wallet, maybe because I've left it somewhere or I've put it somewhere and I can't actually remember where it is. That's different. So it's about the company it keeps and the impact that it's having.
So what do you say to those people or those families who they just don't want to know? They've got the niggle, you know, the niggle, whatever it is, right? But you don't want to know. What do you say to those people? Because we say you should get an assessment, but they're nervous to do that. How can we put their mind at ease? Is it them understanding that some of these things are actually reversible if we can get to it? Now that feels pretty hopeful.
And some of that comes down to that nihilistic attitude that people have about older people. What nihilistic means is like we just say, oh, well, you're getting old. That's all just, you know, you know, it's all part of that greyness of getting old. And it's kind of a bias that we have.
An ingrained bias.
An ingrained bias that we have around older people. As I said before, dementia is scary. It's not even a nice word to say. But if I can offer that hope again, it's about the right diagnosis and saying, this is what this is. This is what we can do. We walk alongside you in that journey, no matter what happens, no matter, you know, if we take the adage of a walker or a boat, you know, no matter what kind of happens and if a wave comes over, we're with you, we're supporting you moving forward. And so that's what we can do at Brightly to support our clients and their family in that waka together and helping navigate the way forward. So it's not quite as scary.
I bet it seems to know if the people who are starting this early stages of dementia actually know it themselves. Can they tell if they're
tricky? That's a really tricky question, and that actually comes down to the type of dementia. So to explain that, dementia just means memory impairment, okay? But you don't just get dementia. This doesn't sort of whack you on the back and say, hello, here I am. It doesn't work like that. Something has to be happening to the brain. And so the way I explain it to people is dementia is kind of an umbrella term. And under that umbrella is a whole lot of different medical conditions that cause the memory loss, the memory change. The most common one is one we all know about and one people fear the most, which is Alzheimer's. But then, you know, there's something called vascular dementia, which is a condition where people get one major stroke or lots of little strokes that impacts their memory. Sorry to say, but alcohol causes a type of dementia. People who've got Parkinson's or a condition that we call dementia with Lewy body, which is somewhat similar to Parkinson's, causes dementia. So that's what we're saying about the assessment, is getting the diagnosis. There are treatments for Alzheimer's, there's treatments for dementia with Lewy body, there's things we can do for people with vascular dementia. So that's why we assess. Back to your question about, your question is really about what we call insight. So insight is, does the person actually know what's happening to them? And that doesn't always happen for people that they don't always recognise that's happening, particularly in Alzheimer's dementia, where people will swear black and blue that, no, doctor, you're completely wrong. I don't have dementia. I'm fine. Okay. I'm a specialist, but okay. And that's just a feature of the dementia. And something like vascular dementia is quite different. And when people go, oh, my memory's shocking, I know it's shocking, and I so it's all about the different type, and that's why the assessment is really critical to say that this is the type of dementia you have, and this is what we're going to do to help you.
Some of those blanket terms just aren't helpful when you're trying to treat something. Kind of the Google doctor that I often refer to. You come in hot with a term, but as you say, there's so much under the hood that you're not even aware of. Back to this early onset dementia. How early is early? Like, what are we talking here?
That's a really difficult question. You guys ask hard questions. And I think that the problem we have in dementia, particularly the sort of the neurodegenerative. So to explain that a bit more, neurodegenerative means obviously degeneration of the brain from things like Alzheimer's or Parkinson's disease, or this thing I talked about before called dementia with Lewy body. So changes are happening within the brain. The problem we have is those changes are happening way before the symptoms actually start to come out, what we call this preclinical phase, or prodromal phase is its other term. And what's happening over time is the brain is losing brain cells or neurons over time because of the disease process, and then it kind of quits. And then it hits a critical point, and then the symptoms start to manifest. So it is really hard to know what early stage is.
But you can get in, if you knew that there was decline in those early stages, you can offer some interventions at that point.
We can intervene at any stage with anyone with dementia, but particularly in those early stages. So one of the key things that I talk to my patients who are concerned around their memory and when we assess them is around physical exercise. So time and again, many studies have shown the benefit of physical exercise. As I say to my patients, I think it's as simple as getting more oxygen up to your brain. It's not neuroscience or rocket science or whatever. It's just about getting more oxygen up there. So, by doing, and we're talking aerobic walking, and I say, getting out and doing a walk 3 times a week is really good for your brain health. And we should be doing that at any stage of our life. But for people who are in those early stages of dementia, or even those who've got established dementia, getting out there and doing physical exercise is really critical.
So you really can slow the onset sort of dementia and almost, in a sense, reverse?
Yeah, you can absolutely. You can improve the trajectory for that individual person. One of the things we haven't talked about yet is something called mild cognitive disorder. I think I mentioned it a little bit before. So there is, we talked about that for neurodegenerative conditions like Alzheimer's, that they're losing those neurons over time. Then they might get what we call a preclinical phase, or before the onset of the true dementia, is this thing called mild cognitive impairment. And mild cognitive impairment is the forgetful person who has no functional change. So they're forgetful, they forget where they put their keys, their glasses, whatever it is, but it's not having a functional impact. If we can pick those people, we know about 10% of them will go on to develop Alzheimer's. But if we actually really intervene on those people, we can keep them in that phase. And that's where the physical exercise comes in.
And it is all to do with exercise, pretty much.
Pretty much. And managing vascular risk factors. So managing your cardiovascular risk, so that's your risk of heart attacks and your risk of strokes, is really important.
Amazing. So if you had one piece of advice for someone who is worried they're developing dementia, or they have a parent who they think might have, or they've taken a test, whether it be one of those quick ones on the internet or a comprehensive test that says you're developing it, what would we say to those people?
Get an assessment. Get into what is causing the problems, looking at whether they've got functional impairment, looking at the whole picture, thinking about diagnostics, so that might be getting a scan of the brain, and working out what's actually happening. Once we know what's happening, then we can target our intervention. There are drugs that we can use, but sometimes it's simple things like maybe your medications having an effect on your memory. So there's something called anticholinergic medications, and for the uninitiated, that really it's something that happens to change the neurotransmitters in the brain, and that if you're on those medications long term, they can actually cause memory decline. So, in our Brightly assessment, one of the things our pharmacist does is look at the medications you're on, looking at what we call the anticholinergic burden, and saying, okay, this is where we need to intervene, this is what we need to change, and this is what we need to improve. And, we can improve people's memory.
Well, that's great. Dr. Cheryl Johnson, thank you so much.
Thanks very much, Mark and Heather.
There's so much more to learn, so we are going to be doing a series on dementia in the next few months, so stay tuned for that.
And you can find more information about how we can help you manage ageing and dementia at Brightly or in the show notes.
Now, if you've enjoyed the podcast, please give us a review and click that subscribe button.
Thank you for listening. We'll see you next time on The Next Bit.